All right, welcome everyone. As you're coming on, we appreciate you being here today. We're going to let people file in. They're in the waiting room and just coming in now. And as you come on, those of you that have been on our webinars before, you know, we'd like to hear who you are and where you're from. If you'll just go into the chat and let us know where you're joining us from, just pop in there and do that. And if the chat isn't working, you just go into the Q&A. So let's make sure we go into the chat and make sure it's open. Let's see here. Okay. And so again, just let us know where you're from, whether it be in the chat or the Q&A. We'll make sure that ask him to go on there and open that up. And I want to make sure you can hear us okay. So again, just as you're coming on, let us know. All right. Hello, Dr. Lankering, Colorado. Appreciate you being with us. And looks like it's filling in already. We're close to 30, going up higher to 40 here. We'll let it come in. I think we had over 200 or 250 health professionals sign up. So we appreciate you all so much. Lyle from Kansas, welcome, welcome. Maryland, thanks for being on, Michelle. Dr. Novotny, thanks. Nebraska, Ontario, Canada, thanks for being here, Dr. Wayne. Dr. Creamer from California. Dr. Stockwell, Boise, welcome, welcome. We got Texas in the house, Colorado also. Dr. Gutierrez, thanks for being on. We'll just give it about 30 more seconds and we'll get going. We have a lot of great information to share with you. Dr. Brimhall is going to really share some phenomenal things with you today and just kind of whet your appetite to what's going to be coming. Dr. Ridgway, thanks for being with us. We always know it's time to get started when Dr. Ridgway is with us. Thanks for being on with us. All right, so let's go ahead and get this party started. We're in 3 different places right now. We have the staff in Pima on monitoring and providing the help. Dr. Brimhall is here with us from Gilbert, and I'm actually in Las Vegas right now attending a seminar, getting some more information and research to help share with everyone. So real excited to continue on and to be able to help you all. And that's kind of one of the things that's exciting about our work is whether Dr. Brimhall's learning from patients or doing research on his own, or myself that way, or I'm off somewhere. We're always working, doing the research. In fact, our cohort right now at Dr. Harris is in Sweden. And so I'm sure he's going to come back with some great information for us and probably some list of nutrients we got to track down from somewhere around the world when he comes back. So we're excited about
Maybe
that.
he'll be married. A Swedish girl.
I'll let you tell him that. That's funny. But let's jump into it today because this is a really interesting a topic that is, I think, really being held under the radar on purpose. And hope Dr. Brimhall will even talk about some information that came out today, but it's one of the main topics that's going to be talked about at Homecoming. And today you'll be hearing just a little from me, but mainly from Dr. John. And Homecoming is really a focus that we're wanting to be able to get doctors signed up for early because of all the things that we're wanting to do at Homecoming, this being a very special Homecoming. And we're going to be honoring some of our great friends that are no longer with us and have a full agenda. And we're wanting as many of the clinics to be signed up ahead of time so that we can really plan for an event that one that's memorable beyond all the rest. So I wanted to start off with this, although at the end we'll go through the agenda a little bit more so you can see some of the new and exciting things along with the things you just need to hear over and over again that we're going to be sharing with you. But you can scan that QR code. So if you have a phone, just go to your camera and put it on that QR code on the screen, and it will go to the sign up hub for the Homecoming seminar, or you can go to ohsforlife.com/homecoming or HC23. And so we're very excited about this agenda that Dr. Brimhall laid out for homecoming. And one of the big things that, as he'll share with you in a minute, I just want to kind of lead into this, that's really a big factor is the long COVID. And we're seeing this with everyone from the patients that normally come in to athletes to CEOs to just people that didn't get affected, they thought by COVID, and they were asymptomatic, but they actually had it, and it's affecting all people. And we know the COVID statistics that keep coming out. This is the latest ones that just came out a few days ago about spikes and the new variants. We talked about the variant a while back at one of our webinars, and we know that it's still there and hanging out. But today we're not going to talk so much about it as the long COVID. And this is a actual release from the Center for Disease Control. So from the CDC themselves, we know the numbers sometimes aren't the most accurate as far as maybe trying to downplay things, but even their numbers say that 1 in 5 American adults who have had COVID still have long COVID. You think about that. That is a huge percentage, over 20% that they're tracking, let alone we know that there's probably more than that, but tracked, proven 20% minimum of the people that have had COVID have long COVID. And so that's a very serious number. I think a lot of people don't understand how serious it is, except for a lot of you health professionals that see this every day, like, man, things are weird. Things aren't going right. My normal treatments aren't working like they should. And it's something that now is so statistically evident that we know that at least 1 in 5 have it. And what's interesting is the American Medical Association just came out and said, hey, we have a plan for long COVID. But the problem is, how did their original plan work? And so, yeah, we're being told to buy into some new plan that they're going to have for what to do for long COVID. And you're going to see this roll out in the next 4 weeks, this plan of what you should do for long COVID. But yet their way to fix the first problem backfired and actually caused a lot of this you're going to hear about from Dr. Brimhall. So I just think it's funny that we're supposed to wait for this new program when they didn't get it right the first time. So we know what does work. And that's why we're excited today to have Dr. John with us. I think that I haven't had a conversation with Dr. John in the last 6-8 months that he didn't bring up this subject, because he's so passionate about it and working on this daily and seeing it with the patients and working on the program and protocols that you're going to get in depth at homecoming, but you're going to be able to hear about it now. So I want to give that lead in to this. Isn't something that's, oh, it's just some little thing that we're going to worry about with a few patients. This is a huge problem. And Dr. John, thanks for being here, and take it away.
All right. My definition of retirement and Dr. Harris is a little bit different. I'm actually sitting here in my office. I see you, Big Doug. I don't see me. Is that the way it's supposed to be? I can't tell what I'm really showing. But in the office here, it's a big room. Actually, when I bought this house, it was a theater room. But right now, we have it set up as a research center, and quite a few have been in here and been treated that are out there right now watching. What we've been finding out is long COVID, by their definition, meaning the AMA, is that people got it, and guess what? It damaged the lungs, it damaged the kidneys, it damaged the heart, it caused different damaged areas. And now they think that they're going to somehow go back and get those magically to heal, but we know drugs don't heal, drugs cover up symptoms. So I think we're going to have to look at what we've been doing all along here. And this test kit right here is certainly going to be very, very important. I'm sure all of you have that. If not, you need to get 1 or 2 and keep it there all the time, because every patient comes in now, I check them for COVID. Now, what does that mean? They have active COVID that would test positive on the medical test? The answer is no, they would not. But the body's hiding it. There's something here that nobody else is talking about, and I don't know how much trouble I'm going to get into saying this, but whoever manufactured this bioweapon, I know that's a controversial subject, so I can't believe I said that. They made a stealth organism, a backdoor mechanism where the COVID goes into the cell and the body doesn't know it's there. Now, the long COVID they're talking about is, yes, you have heart damage, you have liver damage, and because the COVID got there, it caused problems, and now they want to see what they can do about it. The only thing you can do about it is to use the nutrition that we've developed here, But like Goodhart always said, you have to find the problem. The body has to know where the problem is so it knows how to fix it. So with the testing that we do, the regular scan, to say a new patient comes in, I do the whole test here. I found out they need liver, kidney. I find out they need enzymes, they need probiotics. But I found the heart is weak. I find iodine is so deficient, the thyroid is malfunctioning. Well, how would I know the difference between thyroid and iodine? Because when I'm testing them, and let's say the thyroid goes weak, by testing that and they go down, then I'm touching the thyroid here, or I can touch the pituitary hypothalamus and the thyroid. If that goes weak in the clear, I know we just need to address it. But what I can do is go to OptiThyroid and have them hold it in their hand. And now if they go strong when I'm holding this in places, we know they need OptiThyroid. If I put iodine in their hand and they go weaker, then that means they don't need iodine, just thyroid. Sometimes it's the other way around. They may need the iodine, but not the thyroid. Sometimes they need both. You all know how we test that. If you don't, you really got to come to homecoming because you're way behind the 8 ball there. But here's the story. Let's say a new patient comes in and I scan them, doing a regular scan for them. They show 4 things that they need. Then I want to know, do you have long haulers? Do you have long COVID? Well, of course, we want to know if they do. And let me tell you, it's a lot more than 20%. I see whole families, 3, 4, 5 people have it, 6, 7. I had one family that, and the only one that didn't have it is in college and she wasn't living at home. Every one of them had long haulers the way we define it. What does that mean? I mean, our genius, Dr. Harris, made a homeopathic vial that introduces, excuse me, Susie and I went back to the Midwest last week. We rented an Airbnb and it was full of black mold. So I'm fighting that off a little bit with all the good nutrition I'm popping about every hour here, but that's nasty stuff. When I put this in their hand and they go weak, that means to me that they have long COVID. Now, listen to what I'm saying here. Then that's vial number 1. I had Dr. Harris make vial number 2. This is a product that he has made to help the body to heal. It's not a homeopathic, it's not a regular vitamin. It's one of his new inventions that he has patented and they're working on it right now. We get to use it for now. If you don't have these, you just call my office, call Jason at my office. I think everybody has brimhall.com if you know where it is. And you tell them you want the test vial and then you want the vial number 2. We call them vial 1, vial 2, so we don't get in trouble with any of the organizations out there. So let me back up a little bit. Patient comes in, I do a regular exam, your blood pressure, whatever you do. And then the next thing I do is I check right and left brain, make sure that they're testable and they're clear like that. And then I have them, I put this in their hand. And if it's positive, it won't even make their arm go weak. It made every muscle in the body go weak as I test it, which tells me there's hidden COVID in the body. It's in there in the stealth mechanism where even the cells don't know it's there. They've really created a monster here for us. Now, when they go weak from that, they're weak everywhere. Now, what do? Vial number 2, you take it and you drop 1 drop on top of the tongue or under the tongue. And now, if vial number 1, COVID homeopathic made them weak, and they do have long haulers, COVID number 2 will make them go strong. And you say, well, that's kind of cool, but what now? Here's the real crazy part about it. When you test, 1 vial goes weak, next it makes them go strong with 1 drop under the tongue. That's all you give them with 1 drop. But now when you test the patient, go through the regular scan, and especially check the eyes, check the carotid arteries, check the spine, check all parts of the brain, therapy localized, in other words, you touch an area and see if they go weak. If they go weak after taking the 2nd drop, that's where the long COVID is living and not able to tell the body where it is. So you now know where it is and you go ahead and correct that. Now, what if I find a liver and a heart and a kidney and an adrenal and a brain, which I will on most of the patients. There's that many places being affected. And somebody will say, man, my eyes have just been killing me. I don't know what's going on. When they say that, I know there's a great possibility that COVID is going to be in there. I'm going to repeat myself. Give them that. They go weak everywhere. Give them 1 drop of vial number 2. They go strong. Then I therapy localize the eyes. I just go like that, and they go extremely weak. So when we treat them, with that knowledge in there. What you've just done is put it on the computer. Oh my gosh, I mean the body's computer. I didn't know I had COVID in my eyes, but that's exactly what you have hiding there. When we do that, then of course we know the nutrition for that is Protect, right? Essential Protect. Dr. Harris made such an incredible product. We'll put them on that. What if their adrenals blow weak, which the majority of them do, because this has attacked our body so bad, we're having a hard time keeping up with all the demands because so many organs were hit with the COVID. So now, if adrenal, I just touch the adrenal, check it, it goes weak too. Now I check them to see if off the adrenal makes them strong. And it will 99% of the time. What if the kidney is weak? Because you can touch the kidney and then the adrenal, they can both be weak or individually. It might be one side and not the other. You have to really go through and do a systematic evaluation. So now the adrenal went weak. I'm going to put it off the adrenals. I have them on for Essential Protect because the eyes show weak. I have them on off the adrenal because the adrenals went weak. The kidneys went weak also, one or both sides. So there's liver kidney that they're going to get. Now let's pretend that's all, but it's not. Rarely will you find only 3 things there. Very often I find it in the spine. Even I found in some people to how well this is going to show up, but you test right here in the leg because, as you know, the bones help to produce platelets. We found some people with very, very low platelets and they tested there, or the carotid arteries test positive, or anywhere in the spine, brainstem. You say, you're sure saying a lot. I'm saying a lot, but I'm saying 1, 2, 3 things. Check them, see if they go weak to that vial. If they do, 1 drop here, then you check these areas and you give them the appropriate nutrition that shows up to that, which we have in the test kit between the regular OHS products, the essential, and the off the line that I did. You've got about everything you need to help this person back to restoration. Let's tell you this one family that came in, and I found it in 5 of them. And the one girl who is about, let's see, I think she's 13. I found her heart showed up only after I gave her vial 1 and vial 2. Did not show up in the clear. Then when I had her hold the vial, and you have them hold the vial that tells the body they have COVID during the entire treatment. I don't care if your treatment's 5 minutes or 50 minutes, the entire time they hold that vial to remind the body what you're doing. You can't find it, you can't fix it. We've just found it for the body. I had her hold the vial as I did the treatment, and she said, oh, I can't hold this, I can't, it hurts my chest. Listen to what she's telling us. Holding the COVID vial made her chest hurt. She was actually crying with the pain. And you're going to see this. You're going to find when you palpate areas, if it's test positive, just hold the vial may make them extra sore, or another area that whatever you find it at. When you palpate it after they hold that, it's a different than when you have it given them the vial. Now, what is the treatment? Oh no, you got to come to homecoming to hear that. Doug told me I couldn't give all my secrets away, but I will tell you this: we're going to use all 5 factors of central integration, and we'll go over that and show you exactly what happened. If you did nothing but the vial to diagnose it, 2 to find out where it is, and you locate it, and gave them the OHS nutrition that solves each one of those reflex points, you're on the way to recovery. The problem is there's an emotional component to every one of these miserable things. Let me grab one book real quick. And if for some reason you don't have Feelings Buried Alive Never Dies, at the office we used to always carry them, but now Amazon sells them cheaper than they'll sell them to us for. So we just say, go to Amazon and get Feelings Buried Alive. Feelings Buried Alive Never Die. We read this in to a piece that we have time to do. I do a lot of hour appointments, and I will, in the family of 5 or 6, we'll put them all together and we'll do a couples integration or family integration with the color and the sound and the emotions at the same time. And you're absolutely changing lives. And the people have their eyes going out. One treatment, their eyes start coming back and they feel better. They're afraid they're going to go blind. In the Feelings Buried Alive book, let's say that I found eyes. I go here alphabetically towards the back of the book, and if eyes went weak, I can read in exactly what the emotional components are of the eyes. You see how involved this gets now? The body now knows it has COVID. it knows which organs it's in. You're addressing that with nutrition and structural correction. And you're also going to the emotion. And with eyes, here's some of the emotions that happen from eyes. Not wanting to understand what you're seeing, not seeing the truth, fearing the future, not wanting to see life as it is. Life is weak and out of focus. Well, we'll go over this in over and over so you get it. But we tap all that in. We highlight on the computer. Remember, the body is like a computer, but it's a live computer and it's a hologram. Every part about the body knows about every other part of the body. So when we're treating that part for the eye, we want to include the emotions on there too. And then if you have the tuning forks or the colored glasses, and we now have the chart, we don't have to lug all these glasses. It's a lot cheaper. You can do sound, color, emotion, all at the same time, and you just get amazing, amazing clearing. So how many of your patients you're going to find this on if you check them tomorrow? Probably half. It's scary. And the symptoms, especially somebody's referred to you because they've been everywhere, nothing's helped. They have no energy. They're completely fatigued. And so, well, I'm thinking about getting the Opti Life Force in there, right? I'm going to make sure that we get those mitochondria working good. Heart, I would say probably 30% of the people have a heart following COVID, long COVID. Kidneys, adrenals, you're going to find 20, 30% there. And even the medical literature is talking about how bad the adrenals have been involved and it's causing problems. Now, here's the key about our nutrition different than anybody else. Number one, it's pre-digested. Number two, some of it's even fermented. But number three, it's the whole package. It's the whole package. We have the vitamins, the herbs, we have glandulars in many of them. So the heart tissue itself is in the product. And when you take that, it starts regeneration at that level. And I've gone through, I think I've been ordering 24 at a time. And I should get a medal, some kind of a OHS medal for how much I order, and I'm retired, right? And then the Opti Lung, again, you'll find a large percentage of this. And lung has been one of the things that have been attacked with long COVID. I have patients up to 3 months to repair all the damage that's done. It's not a one and done. It really is not. You have to repair the tissue that's been damaged. And again, we're the only ones that has the answer to regeneration. We don't want to just cover up the symptom. We want to heal. Which one of the products are you going to need for this? Well, if they say OHS on them, Essential or Opti, you better have them in line because everything is showing up here at one time or another. But mainly the glandulars and the Protect, and of course DAC. I have everybody on DAC. You need the vitamin D, and it's remember that the liver kidney I've already mentioned that shows up a lot on there. And what's the dosage? Well, you can test it out, but on thyroid at least twice a day. On DAC is fat soluble, so you take 2 DAC in the morning and have it good all day because it stays in there. You find Opti B shows up, you have to take it twice a day because it's water soluble, it will pass out in the urine. Iodine, be careful with iodine. It's important that we have enough. And if you read Brownstein's work, he's found 90% of the American population is deficient in iodine. This is so absorptive and works so well. Do some testing once you get down the line and check it. Yeah. You do not want to overtreat on iodine. You want to have just the right amount. So sometimes you have to test more than muscle testing. You can do an iodine test. Same with vitamin D.
Absolutely. And I wanted to mention that the other thing that we're finding for a lot of people to help restore the smell and taste is the zinc oxy spray. And I think that it's a little bit separate from what Dr. John's talking about. You want to go in and treat the long COVID and follow the new protocol. But when you have people that are like, hey, I never got my smell completely back or my taste completely back, food tastes different, use the zinc oxy spray and do that. And as Dr. John just mentioned too, with the Protect, the new natural NSAID pack is the Protect with the acute. And that's been the biggest thing to reduce the inflammation, if inflammation's a factor with it. Just as far as the most testimonials back that we've got on anything in the last 4 or 5 months has been on reducing inflammation at a high level. And I think it's Dr. Harris's phenomenal work with the phytonutrient anti-inflammatories with the research that we've had for over 30 years on the proteolytic enzymes. So those are two that are just in your wheelhouse as you're dealing with the exact protocol that Dr. Brimhall laid out to you. That, okay, is there inflammation? We'll do this. If they have the, the smell or taste issues, we can do this, but follow the protocol like, Dr. John mentioned, but I just wanted to throw those in there.
Yeah, absolutely. And of course, I use the oxy spray on all the patients with active COVID as well, because it's part of the therapeutic area. Remember that check the mitochondria. Remember how we check that? We just check a muscle strength. They should be able to test 10 times without getting weak. And most of these people go 1 or 2 and they blow out. So OptiImmune viral to help knock out the infection, but then you need to have the OptiMito force to help regenerate there. And of course, Dr. Harris has some very good products to help mitochondria as well. I mean, this is a horrible condition, and we have the answers to help these people above anything I've seen at all. So
Yeah.
we're going to be this shows the testing that we'll be doing there. We'll be going over that. Dr. Brett's going to do a 3-hour course for all the new people coming. I'm going to do an advanced course for 3 hours. Dr. Harris is going to cover stem cells. He's going to go over all the nutrition we have, like OptiMagna Stem. We have actually a stem cell nutrition, plus some of the nutrition he's developed helps it as well. Now, the injections are going to be available before the seminar starts. We probably could do a few in the seminar when he's teaching his 3-hour course, but you can call my office and order that. We'll have a special on that, and I'm using a great deal. They had this new company that we have is amazing, and they have really good prices so we can get. And we're using not only stem cells, we're using 5 million stem cells in 1 cc, but then we put 400 billion of the exosomes, and the exosomes are so small it passes the blood-brain barrier and goes right in the brain. So we're using that to help people get well from the inside out. The symptomatic expression, be it Parkinson's or Alzheimer's, have definitely improved according to what Dr. Harris has told us over the years. So he'll be covering that, how we do with injection and also nutritional. But call my office, Jason, to order the vials. If you want to order and get a stem cell while you're there, he'll be administered. He's a medical doctor and can do that for us.
Perfect.
What else do you have, Doug?
Well, I just wanted to mention for the doctors that haven't pulled the trigger on homecoming, we really, as I mentioned, wanted to make sure that we got as many clinics, everyone in your clinic that you're going to sign up, not just yourself or those that have signed up, but yet they haven't decided how many in their clinic are coming. Please make that decision. We want to give you incentive to do that by tomorrow, end of day. And we'll throw in your next order some of the Optilong Dr. Brimhall talked about, the oxy spray, and one of the tarps. And the thing is we're doing that just as a way to say, look, we want to serve you so much at homecoming, and it helps us so much to know how many are coming ahead of time, that we wanted to give incentive to do that, because then we can plan things out. For those of you that know, that came to like the super seminar a while back, and we had the Hawaiian people there and things, to do all those little extra stuff. And a lot of it depends on how many we know is going to be there. So we want to give that incentive. But real quick, let's go through. Dr. Brimhall mentioned a little bit about a homecoming, and then I'm going to bring up one last study. So make sure you stay on, because you're going to freak out on this. Dr. Brimhall sent it to me earlier. I've spent, like I said, I'm here doing some seminar work with some and training and research, but I've spent some time on it, and I want to go over a brand new research information with you before we get off, that you're just going to blow your mind. But basically, we're going to start off again Thursday evening, where you come in and do the testing, which is a great time, get recertified on the 6 steps, and be able to take advantage of that. We highly recommend you come in Thursday, fly in Thursday, make sure you're there Thursday evening, because we start bright and early Friday morning. And we're going to start off with Dr. Brimhall's talk on every single detail of the long hauler protocol. So you're going to get, right off the bat, going to get that fire. And then Dr. Harris is going to go into the cell biology, the mitochondria. Going to be phenomenal what he goes into and explains about the need to help the mitochondria even from different levels than what he's done before. I'm going to be going through and sharing with you guys some of the new information we have blood-wise, be able to go through some of the new research on the products that we have that's come out, and studies on those. That's going to be really great to hear about. And then we're going to again hear from Dr. Harris on the stem cells. There'll be a couple breakout sessions. Remember, homecoming we do have a lot on the main stage, but then we will break up a little bit to be able to, for those that want the in-depth information on 6 steps or brand new on that. Me and Dr. Brett are going to be going through some of the blood testing work in a nutrition workshop and one of the breakouts. Dr. Von Coops.
Doug, let me input here one thing. If you ask yourself who should attend, it's anybody you ever met or will ever meet. That's what you attend. Dr. Brett's going to be doing all the basic 6 steps. I'm going to do the advanced 6 steps, and we're actually going to treat complicated cases. So if you're just new and getting started, or if you have a new CA getting started, you have a new doctor getting started, they all need to get here. There's not anybody in the office that doesn't need to be there understanding this. So they understand the nutrition. They understand what testing you're going to do. They're your best advocates out and about referring people in. I mean, how did I get 50 to 70 new patients every month? Because I talk about what I do, and everybody that comes in, I talk about their family, and we do show and tell. This seminar is going to teach you how to do that. So if you're not getting 70 new pages a month, I'll show you how we do it.
Absolutely. Absolutely. And we have some neat new things that not only is Dr. Harris going to get turned loose on some in-depth information like he usually does, but we're going to be launching some new formulas for you guys, some new information, the long hauler protocol for Dr. Brimhall. There's going to be a lot of great new stuff. And I think a lot of you know the great friend of Dr. Brimhall's, and a friend of mine had passed away, and we're going to do something special for him in just memory of him there, and a few things that we just want you to come for also, just out of a great respect for those that have spent decades in this field that we want to honor there too. So
yeah, we might just mention, I think we should say Dove's name. And he was only 62 years old when he passed. He had a bout with cancer here a couple of years ago. I'm sure left a situation with him, but it is just so unexpected. And we have sent out from the puzzle pieces and where you can donate money to the family. If you don't have that, but you'd like to do that, just call my office, call Jason. And I think it's very fitting that we help the family. They lost their total source of income, not their whole life. The daughters, the kids, the cousins, all lived chiropractic.
yeah, and Dr. Weidenbaum was just a great man that loved the 6 steps, that loved holistic medicine, and basically gave his life for that. So we definitely will miss him greatly, and want to make sure we give the respect to him together as a group at homecoming. So we'd love to have you there. For any of you that have known him at all over the years, would love for you to be there to just give that honor and respect for him and his family. So thanks for sharing that, Dr. Brimhall. The theme is keeping the doctor alive, talking mainly about your clinic, what you need to do in the changing world, you personally. And I love the theme that Dr. Brimhall came up with this, because we're going to be able to help with not just your patients, but also, again, with your own health. We'll have a lot of testimonials from doctors from the previous seminars that have made some commitments to their own health and made some improvements, and seeing how that's improved, not just their personal health, but their clinic's health, their family's health, and just really be able to try to help motivate you all to even go to that next level. So again, please scan the QR code or call the office. The reps are there now. The 1-800-890-4547 to be able to set you up with the seminar. Again, the more people that come is discounted down. We do our very best to make this something that's very affordable for you to be able to be there. And it's a great time of year to be in Arizona too. I mean, it's you don't have to worry about the snow and that. So as promised, I want to end with one thing and let Dr. Brimhall kind of bring it home. Dr. Brimhall sent an email earlier that talked about the possibilities of people that have had the vaccine not being able to be organ donors, because when they've used the organs, they haven't taken properly. And so I clicked on the study. I am still going through the study, and the study looks like it was done well, and I'll be going through it in more detail. It's quite extensive, everything that's in it, and it was mainly focused on corneal grafts, but it shows that in the review that I've had just today, since Dr. Brimhall sent that over, that there is definitely some issues with people that were organ donors that were vaccinated versus ones that were not, that there was some problem with the donating organs from the people that were vaccinated. So I'll get into that more, but it's interesting as we take a look at this situation with long COVID. Does that play a role in it? You know, how in depth was that study? We'll find out, but I'm excited about diving into that more and maybe reporting on that at homecoming also as maybe a lead in before Dr. John's, talk on that. But do you want to mention something about that, Dr. John, and maybe bring it home a little bit?
I think you probably said all that needs to be said there. We don't want to make a statement we can't back up, but that's what it said is happening. And we know about shedding. If you're working on people that have had long COVID, we've had people's legs start hurting, their feet. So definitely there's something about that shot that leaves residuals in there that can cause harm. Does it cause any good? Well, I hope they can prove that it did for everything that people went through. The one thing I would like to say is that my mortality is becoming more real to me all the time. That was only 62. I'm 75. I'm one of the few guys left that got to see in person Dr. Goodhart, Dr. Gonstead, D.D. Palmer. He was actually not Daniel David, but David Daniel, right? And almost every famous name you can think of that was there has passed away. Lee Fuhrer, Dr. Lee's here, or Dr. Fuhr's here, but Dr. Lee passed away a long time ago. All the research that was done for standard process, he's been gone 50 years. So I'm one of the few old timers left, and you never know how many more homecomings I'm going to be to. My job is to leave you guys everything that I have gleaned from D. Jarnett and Goodhart and Gonstead and some of the people you may not even heard of. So we studied the cranial sacral, we've studied spinal, we studied extremity, we studied the percussor from Fulford. They're all gone. I'm one of the few that's left that took all those works. In fact, no other chiropractor was ever allowed to take the cranial sacral work that Fulford did. So come and wish me well in my 75th year, right? And let me give you everything I have. I'm practically giving it away. And you don't have to go everywhere I went to learn all these different techniques. We're going to dump them on you like a fire hose. I'll see you at homecoming.
Hey, thank you so much, Dr. John. And that's a great way to end it. The thing is I just wish I had one more minute with so many of these great people that you had mentioned, even Dr. Weidenbaum, but, being on the stage at Parker over those years and even the Jim Rohns and all these people that we kind of took for granted at the moment. They're no longer with us, and we need to take advantage of every minute we have, whether the person's 20 years old, 40 years old, 72 years old, whatever it is. If we have the opportunity to learn, we need to take that opportunity and run with it and make sure that we apply ourselves. That's why you're where you're at today, Dr. Harrison, Sweden. We're in Vegas. We know that it's precious, at times precious, and we need to take advantage of those. And so we're going to do our part to make this the greatest homecoming ever. And we deeply appreciate you guys so much and everything that you do. And we'll look forward to, again, the reps are there for the next 30 minutes. And the special's on till the end of the day tomorrow. We really love to get a count on who's going to be able to make it this year so we can make it extra special. So again, thanks so much. Thanks so much, Dr. John, taking time from your precious day in retirement that you're working harder than ever. And we'll look forward to seeing everyone at homecoming.
And thank you for all your messages. We're reading those as you type them in. It's very, very heartwarming to see your thank yous and to know you're learning and loving what we're doing here.
Yeah,
it's a heck of a team, Dr. Harris and Doug and myself and all of his people he has with him. Thank you for allowing us to serve you.
Thank you. Take care, everyone.